Thank you very much. And I've just shared screen. I hope you can see that. It's an honor to be with you, and I look forward to this conversation. I have a lot of slides. I will make them available to you so that you don't have to worry about losing something. And the last section is from an article that I wrote about leadership in public health that I'm also happy to make available. And I see this as a partnership. Countries are really absolutely the center of what needs to be done to strengthen our work in global health and to achieve results. And so I look forward to deepening the current partnerships that we have at Resolve to Save Lives with the countries in the EMRO region. Let's start with COVID in EMRO. We know that EMRO is particularly vulnerable to health emergencies such as COVID-19. 12, and you know this better than I, and if I get some of the details wrong, my apologies. 12 of the region's 22 countries have ongoing armed conflicts. 9% of the global population, but 43% of those who need humanitarian assistance, and 64% of the world's refugees, with serious concern about outbreaks among large migrant worker populations who often live in crowded and substandard conditions. These are reported cases and deaths, but we know that that's only a small fraction of the actual total. The MERS outbreak really, and the response to that, was a dry run, really, for the COVID pandemic. And there were important lessons learned that have been useful in responding to COVID. These include the early establishment of emergency response structures, which is essential. Saudi Arabia did that early on during the MERS outbreak. Emergency preparedness plans to support more effective responses. And Qatar also did this to reduce MERS incidents. Sustainable improvements in public health capacity are critical to respond to this and the next pandemic. Fighting future pandemics requires regional collaboration and coordination, cooperation, to increase the efficacy of the different public health interventions. A more unified and coordinated response reduces disease spread in the region. More resource enriched states can provide logistical, technical, and financial assistance to neighboring countries. Coordinations within different sub-regions would improve response effectiveness, but stronger national and subnational capacity is the most important predictor of effective response and is needed everywhere in the world. There are three essential leadership lessons of the pandemic: organization, science, and communication. Organization, including incident management for the designation of a unified command, crucially important. Science, evidence-based implementation, recognizing that as we learn more, we can do more. The hallmark of an effective public health program is that it is continuously learning and using that experience to improve performance. And communication. Effective communication is essential. Be first, be right, be credible, be empathetic, and give people practical, proven things to do. Now, we know that better governance and better public health are both needed. Many well-prepared countries performed quite poorly. Preparedness was insufficient because bad politics trumped good public health. Failures in planning, organizing a national response, implementing science-based policies, communicating effectively and accurately were lethal. But in addition, public health programs all over the world, including in my country, the United States, had important pre-existing weaknesses. Weak connections among federal, state, city, and local agencies, governments, and partners. Weaknesses in informatics, laboratory networks, surveillance, trained staff, and communication. And speed. Time is lives. In public health, time really matters, and we have to act with the urgency that the life and death programs that we are entrusted with running merit. Let me say, and I say this not just to my colleagues in WHO, I say this to everyone, that WHO is essential and necessary. And certainly, like every organization in this pandemic, it has made mistakes. But it is essential, particularly for data, for guidance, and for country support. I think of these as the three most essential functions of the World Health Organization: guidance, data, and country support. WHO did provide early warnings in January 2020 that were not heeded. And it has generally performed well in this pandemic, quite a bit better than it did in the 2014 to 2016 Ebola epidemic. But WHO does continue to have problems gaining open and transparent cooperation from many countries. WHO, as you know, is a United Nations entity, and it works through consensus. In the context of emergency notification and response, this probably is not an appropriate approach. The world needs WHO, and it needs WHO to be even stronger. But WHO is not sufficient. We estimate that there's a need for between $1 and $5 per person per year of new funds, not reallocated funds, but new funds for at least a decade to close life-threatening gaps in detection, response, and prevention. That means at least $5 billion and maybe $20 billion a year for at least a decade. Interestingly, a year and a half ago, if I had said this, people would say, "You're crazy. You'll never have that amount of money for this." Now people say, "You're crazy. That can't be enough. We must need more." So I think the fact is that we do need significant resources, but not only financial, also robust, intensive technical support to build national capacity. And not only financial and technical support, but also operational support. Dr. Bill Foege, who led the global eradication of smallpox, when asked, "What's next after the eradication of smallpox?" answered, "The eradication of bad management." Public health is essentially a management problem. Good management of people, that means providing prompt feedback, building capacity, and empowering people. Good management of data to set priorities, monitor progress, adjust efforts, evaluate effectiveness, manage and improve programs. And good management of context, legal, media, social, and political. One of the key lessons from COVID is the need to improve primary health care. We've been talking about this and giving it lip service for decades, in fact, for at least 2 generations. And yet you can count pretty much on the fingers of one hand the low and middle income countries that have effective primary healthcare systems, and many higher income countries don't have effective primary healthcare systems either. Primary healthcare must be at the center of our health system. Care by integrated multidisciplinary teams allows physicians to do more. Patient payment has to be substantially dependent on improved health outcomes. Strong and reliable healthcare systems are central to find, treat, and vaccinate to prevent epidemics. They're critical to build resilient populations. Many hospitalizations and deaths occur because pre-existing, inadequately treated health problems. Healthcare has to change in the context of COVID. We need to improve infection prevention and control, reduce the risk of treatment interruption, and innovate with 90 and 180-day prescriptions, medicine delivery, telemedicine, stronger primary healthcare with team-based care, and treatment in the community instead of in hospitals. Primary care is the most needed but most neglected aspect of our healthcare system. Public health can improve the efficiency of our health system to keep the entire population healthier. Public health and healthcare must work together to maximize health and save lives. Another COVID lesson: we have to strengthen individual and population resilience. Healthier populations are less vulnerable to health threats. We have to address groups which, because of geography, demography, or politics, are alienated from the government, from the health system, from society, and that's essential to reduce the risk of spread. We have to structure environments to support healthy behaviors, to reduce avoidable illness, injury, disability, and death, to address unacceptable health disparities, and to increase resilience to reduce the risk and the harm of the next health emergency. That means more than just stopping epidemics. It means ending the tobacco epidemic with comprehensive tobacco control measures, protecting people from unhealthy food, and promoting wholesome, sustainable, farmer-supported food production and distribution, promoting healthy physical activity, including community design to promote walking and cycling, reducing air and water pollution, especially for communities at disproportionate risk. And where it is a problem, reducing harmful alcohol use by following evidence-based practices, and protecting our children from addiction to tobacco, to alcohol, to drugs, to predatory marketing from junk food companies, and to excessive use of computers and other digital screens. The public health impact pyramid outlines factors that affect health. At the bottom are socioeconomic factors, the social determinants of health. We can address this with anti-poverty programs, education, access to healthcare, eliminating disparity. One level above that is to change the context to make the default decision the healthy decision. That includes things like smoke-free air laws, tobacco and soda taxes, elimination of trans fat, healthy food options, early urban design, promoting healthy lifestyle, micronutrient fortification, banning lead paint. One level above that are things that are long-lasting protective interventions like immunizations, colon cancer screening, brief interventions to reduce alcohol and tobacco use, early lifestyle interventions. At one level above that are clinical interventions, such as control of blood pressure, and above that are health education, counseling. Generally, there is a larger health impact at the lower level of this pyramid and more individual effort needed at the higher level. However, the lower levels tend to be more controversial, the higher levels tend to be less controversial. Effective public health programs work at multiple or every level of this program. Just because we can't make an anti-poverty program doesn't mean we shouldn't stop tuberculosis or heart disease. Now, at Resolve to Save Lives, we have a riddle. When does 50 plus 30 plus 0 equal 100? Well, if we can increase blood pressure control from 14 to 50%, reduce sodium intake by 30%, and get to 0 grams of artificial trans fat, globally we can save 100 million lives in the next 30 years. The cardiovascular disease burden in EMRO is enormous. It's the leading cause of disability in the region, and it accounts for nearly 10% of all daily loss. There is a very high prevalence of hypertension in EMRO and a high intake of sodium. EMRO countries have had some of the highest trans fatty acid intake globally. This is from one recent article. The estimated prevalence of hypertension in EMRO, it ranges from 15% to 26%, but everywhere in the world we see this increasing with industrialization and aging of the population. Now, EMRO has made some progress on trans fat elimination. There was a regional policy statement and action plan, but that was nearly a decade ago, and there's been limited action since. Because of that, other regions are far surpassing EMRO in progress eliminating artificial trans fat. Iran was the first country in the region to regulate trans fat with a ban that was effective 5 years ago. In 2015, 6 years ago, the GCC approved limits that weren't quite best practice limits, but this has not yet been implemented because it needs to be approved before it goes into effect. Saudi Arabia became the first EMRO country and the 14th country in the world to implement a best practice trans fat policy. But progress is somewhat stalled in the EMRO region, and this is something that calls for leadership. Sodium reduction is also enormously important, but we've not yet seen regional targets or country commitments. This is something that can be done. Also to gather and generate data on salt levels in food and support implementation of effective salt reduction strategies. Despite progress, EMRO does lag other regions in the WHO flagship priority of trans fat elimination. Accelerating passage and implementation of best practice policies is crucial, and that can be done by providing technical support to countries for policy development and drafting legal provisions, raising the awareness of harms of trans fat, and building support for policy action. Now, we look for winnable battles, things that really make a difference where you can show progress. This is something that builds momentum in public health. Trans fat can be a winnable battle for countries all over the world. Risk communication is enormously important. I talked about this earlier, so I won't go further into it. When it comes to pandemic preparedness, at Resolve to Save Lives, we're proposing a 717 target that every outbreak should be identified within 7 days of emergence. That within 1 day, it should be reported publicly, investigation and response started, and within 7 days, an effective response implemented. That's going to take sustained investment, but it's possible. Just as 90-90-90 became a global target for WHO in the world and galvanized progress, 717 or a similar target can do this for preparedness globally. Public health systems worldwide have suffered from years or even decades of underfunding. We need creative solutions to prevent outbreaks, detect threats early, and respond rapidly. We can't afford another multi-trillion-dollar pandemic, but we can afford the health security to protect it. My friend and colleague, Dr. Tony Fauci, said, never again. We should never, ever be underprepared for something as catastrophic as what we are going through now. Now, you've asked to speak about leadership, and I've sometimes called this the miracle triad of public health. It has a simple mnemonic, TOP: technical, operational, and political. All three of these features are essential for health progress. Technical rigor. I use the example of Haemophilus influenza vaccination. It's so good, such a wonderful vaccine, that really when you get to a 40 or 50% vaccination rate, you may see the infection virtually disappear in the community. Operational excellence, and I think of tuberculosis in this, where you need to track every single patient who's been treated. And political support, which is crucially important for something like tobacco control or trans-fat elimination. These three things can make a huge difference. We see that in COVID, all of them are necessary. Technical rigor, whether it be in case detection or vaccination, operational excellence, whether it be in contact tracing or the implementation of a vaccination campaign, and political support, whether it be in the decision of when to implement and how to communicate about public health and social measures or others. Now, I will say that we're honored to partner with entities within EMRO, including something called PERC, the Partnership for Evidence-Based Response to COVID. 3 EMRO countries, Tunisia, Morocco, and Sudan, are involved in that. And we've just finished a 3rd round of comprehensive surveys that help countries modulate the implementation of control measures. The Partnership for Healthy Cities, led by our host organization, Vital Strategies, provided COVID response funding and technical assistance to cities in Oman, Jordan, Morocco, and Tunisia. Rapid mortality surveillance. We need much better mortality surveillance. We're flying blind in public health. We need to improve CRVS. This is a crucial area for the world. And rapid mortality surveillance is one on-ramp to that. We've supported work with measurements of excess mortality in Afghanistan, Egypt, Lebanon, Iraq, Libya, Morocco, Oman, Pakistan, and risk communication and community engagement in Pakistan and elsewhere. We also have worked before, during, and after COVID on cardiovascular health in the region. We've supported the Eastern Mediterranean Public Health Network to launch a blood pressure control program in Jordan. This builds off ongoing work with UNICEF and looked at free quality hypertension care in the Indus Health Network in Pakistan. We also have worked with the group World Action on Salt and Health, or WASH, to engage members to develop and launch regional salt targets with a current focus on Oman, Jordan, Morocco, and a partnership on trans-fat elimination to organize training and provide technical support, including capacity building on legal and regulatory measures, NCD Alliance and HeartFile, and GAIN, the Global Alliance for Improved Nutrition. Now, for many years, I gave a talk to new health officers at CDC. I did this twice a year for all of the new state health officers and big city health officers. And after doing it for nearly a decade, I decided I'd better write it up so more people could read it. But I'll take you through these 10 things. And there's an article in the American Journal of Public Health, which we can circulate as well, which goes through them in a bit more detail. First, and I would say foremost, get good data. Data is the lifeblood of public health. And so it's crucially important to improve the quality, the timeliness, and the dissemination of data. It's the one thing that we have in public health that is a comparative advantage, really. Second, prioritize and do the hard stuff first. Usually when someone comes into a position, there's a brief honeymoon period. That's the time to get the hard stuff done, because it's kind of like a new car. The moment you drive it off the lot, it begins losing its value rapidly. When you're in a new position, you have an opportunity to move quickly. Fight and win winnable battles. This is very important. We don't want to be tilting at windmills, trying for things that are impossible, nor do we want to be doing things that are easy and would happen whether we did them or not. We want to have challenges that we challenge ourselves, our country partners, and others to, ambitious but achievable, winnable battles. Hire great people and protect them so they can do their jobs well. I have to say that at WHO, there are many wonderful staff, but also at WHO, hiring and the quality of staff may be the single most important issue to address to improve the effectiveness of the organization. You really need to make sure they're great people. I had the honor of being seconded to WHO for 5 years. I saw very effective staff. My mentor, Dr. Fabio Luelmo, really taught me everything I know that's important about tuberculosis control. He was WHO, he had worked in Geneva, he had worked in a region, he had worked in a country. He epitomized the real high quality that WHO does have at many levels. But I also saw in one country a WR who, faced with the decision of whether to hire someone who was not suitable for the job or repost and advertise again, repeatedly hired people who were not competent. And the result was a WHO office that has a very low level of functionality to this day. So the most important thing you can do is to hire great people. And that means putting skills first, making sure that you're hiring people who are actually able to get the job done, to implement successful programs. It's hard. Hiring is one of the most difficult things that we do, because you need to triangulate. You need to get multiple types of information inputs. You need to address diversity and disparities and understand what it means for someone to be able to function effectively. You need to see, have they actually gotten the job done in their prior positions? And in the interview process, have ways to take problems you're dealing with today. I'll give you a trivial example. I recently had to select a general counsel for our new organization, Resolve, because we've become independent. And we had a small thing happening. We had just had our first board of directors meeting, and we didn't know how much detail to put in the board of directors minutes. And we had 2 finalist candidates. I asked them each that simple question. It was an actual problem that I was wrestling with that day. And the answers could not have been more different. They weren't, neither was wrong, but one of them gave me on the one hand, on the other hand, a very balanced, nice legal answer. The other one told me very clearly, you should do this, you shouldn't do this, and this is why. So we hired the second guy, not just for that reason, but because it was such a clear answer. So hiring, I tell new managers that they should be spending at least 25% of their time on recruitment, even if you don't have a lot of positions. At the same time, 80% of your people are going to be there before you were there, and they're going to be there after you left. So you need to bring people up and work on changing organizational culture, strengthening organizational culture. Fifth, address communicable diseases and environmental health, or you won't be able to address anything else. It's really important in public health that we move to the areas of non-communicable diseases and injury, because that's what's killing people today. But if we don't take care of the basics of communicable disease and environmental health, as we're seeing with COVID, we won't have time or energy or impact on anything else. Don't see the clinical realm. There are too many public health people who say, hey, healthcare is complicated, it's controversial, it's expensive. Let's just stick with the community-wide programs. Healthcare is important. And in all of our programs, there's a healthcare interface. We need to figure out how to make that work as well as possible. Learn the budget cycle from proposal to hearings to review to passage. This is important within WHO. It's important within your countries. How are you going to increase funding for programs? At Resolve, we do advocacy, and we've helped 2 countries in Africa have a line inserted for emergency response and detection, and have that line increased. You have in many countries new legislative bodies, new legislators. How do you identify the main advocates and figure out how you can increase the budget for programs that work? When it comes right down to it, our job running an entity is to get as many resources as we can and to use them as well as we can for maximum health impact. Manage the context. This is something that a wonderful CDC leader told me many years ago. I was in India. The program was stuck. It was stalled. There had been a problem with procurement. It was very depressing. Nothing was moving. And he said to me, the director of the WHO Geneva-based GTB, Global Tuberculosis Program, said, well, change the context. Easier said than done, but you can change the context through advocacy, through effective communication, through working with media, through working with leaders. In that case, the opportunity to change the context came in the form of a parliament question that the prime minister had to answer, and that the program was able to contribute to the answer of, and that did change the context. Never surprise your boss. This was good advice given to me by Dave Sensor when I became health commissioner. You know, our bosses are dealing with challenges that we may not see. We don't have the perspective that they have. So they may see a problem or an opportunity that we don't have. So try to always give a heads up to your boss. And follow these 5 key principles. These were outlined by Walt Dowdle, a laboratory expert who was acting director of CDC. And I've never seen a way to improve on these. They've been on my desk for decades, literally for decades, 30 years. First, be a diligent steward of the funds entrusted to your agency. Second, provide an environment for intellectual and personal growth and integrity. Third, base all public health decisions on the highest quality scientific data, openly and objectively derived. Fourth, place the benefits to society above the benefits to the institution. And fifth, treat all people with dignity, honesty, and respect. And if we follow these 5 principles, we're not going to go very far wrong. Now, there are also practices to follow. Address high-burden, winnable battles. Develop evidence-based prevention strategies. Support surveillance. Increase capacity to advocate for and implement prevention policies. Leverage all available resources and partners. Consult with and learn from peers. Follow up on one policy or program. Choose one thing and make that a mission to you to make it succeed. Do more with less. We're always going to be in constrained environments. Save lives and save money. Find your own winnable battles. Priorities evolve, and they need to resonate with the context and the community that you're working in. Identify your own focus area, recognizing a winnable battles framework, ambitious but achievable. Address public health priorities that have a large-scale impact on health. Implement proven evidence-based interventions that have a significant impact, whether that's on tobacco or alcohol or sodium or trans fat or other. That's a quick overview with some thoughts from Resolve to Save Lives, where our focus is simplicity, speed, and scale. And we think that with that kind of approach, we can accomplish great things. And we know that the World Health Organization is absolutely crucial to further health progress globally. So I'm honored to be part of this important process, and we're delighted to explore further partnerships with you in the days, weeks, months, and years ahead. And I'm looking forward to your questions. Thank you very much.